So I want to thank everybody for coming tonight to tonight's SALT Talks, where we're going to be focusing on transportation in Southwest Ohio. What is out there? How does your child get around the community? What are we going to be looking at? If he does get a job, or maybe other transportation or other needs to get around the community. Transportation is a concern. With many of us parents, suddenly letting your child go with, someone in public transportation, or whether maybe it's a taxi, maybe it's something individual. But there's a lot of concerns as we start looking at these options. So tonight I brought in two speakers. We have Keith Banner with DODD, and we have Shannon Webster with the Greene Cats, and she's also covering a lot of other aspects, which she'll tell you as she goes through her presentations tonight. So I think we're starting with Keith tonight, and I made you co-host so you can share your screen. And I'll hand it over to you, Keith.
Hi, everybody. Thanks, Patty. And thanks, Shannon, for including me in tonight's session. I'm going to walk us through a new service through the waiver system it's called self-directed transportation. But we can also talk about anything else around transportation. But this is kind of the PowerPoint I'm going to talk from and kind of move into it that way. So let me show that PowerPoint now. Great. And this actually is available. This PowerPoint and a bunch of other resources are available on the website. I'm going to go there after I get done walking through the slides with y'all. Basically, in July of 2022, I don't think I told you who I was, did I? I'm Keith Banner, and I'm with the Ohio Department of Developmental Disabilities, and I'm the statewide manager for community life engagement, which includes our initiatives, Employment First, and supportive technology and technology first. So basically helping Ohioans with developmental disabilities and their families kind of focus the way we deliver services and help folks to be a part of their communities in the way they want to be a part of their communities, which could include employment and other aspects of being in the world. So that's who I am. And of course, transportation is one of the biggest kind of concerns and issues and services that we want to kind of lean into if we want to help people be a part of the community. And so from all that comes a service that just debuted July 1, 2022 in our waiver services called self-directed transportation. So I'm going to walk us through that. Basically, transportation is commonly cited as a primary barrier for employment, integration, and other community-based supports. It's one of the #1 unmet needs, right? And for people with disabilities across Ohio. And in fact, the top unmet needs include transportation to work and to get to medical appointments. And it says here 64% of Ohioans with disabilities state they have no access to vehicles when needed. That came from a DC Council's transportation study about 5 years ago. And I don't think we've solved a lot of the problems since then, so it kind of is still pertinent. So basically, we got here to this self-directed transportation moment because several policies and advocacy from folks with disabilities drove the need to talk about it for community-based integrated services and supports. And in 2020, waiver services through Medicaid and through DD and through county boards were redesigned to better fund transportation, and modified vehicles were added. And throughout redesign, advocates continued to promote the need for greater flexibility and more options, including the options some other folks can access, like Uber, Lyft, and other commercial providers not currently available through Medicaid waiver funding. So the pandemic impacted business for many non-medical transportation providers across the state. So basically, here's the way transportation is kind of handled through home and community-based service waivers. There's non-medical transportation, which is a service that provides transportation to and from community employment and day service settings, including day hab centers and sheltered workshops. that redesign I mentioned added funding for community-based transportation and modified vehicles, as well coverage for transportation beyond day service settings and employment to volunteer internships and post-secondary education locations. There's commercial non-medical transportation, which basically is providers of publicly available transportation, also certified through DODD, who bill at their usual customary rate. So basically, any commercial provider can they can access if they're certified through DODD. And then there's just plain old transportation, which is a service typically associated with homemaker personal care services, which are the services people get in their home and community to kind of live on their own and go to grocery store, et cetera. And that's basically the way the transportation worked before self-directed. So who can benefit from self-directed transportation? Well, people working in the community, especially when working late night or weekend shifts, people looking to be more involved in community activities, especially when those activities are in the evening or on weekends, people looking for more community-based or typically available transportation providers, people wanting to navigate the community independently without receiving another waiver service at the same time, and then people wanting to access transportation options that have been previously unavailable through the waiver. So this is the new service and the new rule. And basically the definition of self-directed transportation through home and community-based services waivers, which we just stood up July of this year. This means a service that enables a person to access activities and opportunities available in their community, such as jobs, workplaces, integrated community participation and contribution, volunteer situations, community resources, and businesses consistent with the ISP, the individual service plan. Self-directed transportation enhances independence as it's available around the clock, including weekends and holidays, to accommodate an individual's scheduled and spontaneous transportation needs. So here's our features and uses of this new service. It's scheduled or on demand, access to integrated employment, flexible, access to activities in the community, greater pool of potential providers, and then access also to day services like the other transportation services. So the options include purchase of prepaid vouchers, cards, passes, or tokens to access modes of ground transportation available to the general public, such as modes available from regional transit authorities and ride-hailing services like taxi cabs, Lyft, or Uber at the usual or customary rate or fare, and per mile or per trip reimbursement made to a person who meets the provider qualifications in the rule who has a written agreement for provision of self-directed transportation with the individual being transported. Basically, the self-directed transportation can be accessed and used with Lyft, Uber, drivers like that, and then also in it can be a reimbursement to a pool of providers that we haven't access to, like a neighbor or family member who goes through training and certification. So an individual self-directed transportation budget for a waiver eligibility spend is determined based on the person's needs. So here are some examples of self-directed transportation purchased through vouchers, passes, or reimbursement through a financial management services entity. And I'm going to go into that in a sec. So here are examples: Uber, Lyft, other rideshare services and taxis, public or regional transportation. You can also use it with certified DD providers, family, friends, neighbors, or coworkers with a written agreement. So again, it widens the pool and scope of transportation options for folks who are accessing home and community-based services waivers. So there are limitations on families as providers. That it means parents and guardians may not provide services to their minor children, and then guardians of adults may only be a provider approved by the probate court. Wanted to get that in. So who can provide the service? I've kind of mentioned this throughout. A vendor of ground transportation available to the general public, someone chosen by the person. The chosen provider will receive per mile or per trip reimbursement in accordance with the written agreement. And then an agency provider can also provide self-directed transportation. So I mentioned financial management services, the entity, it's FMS is the acronym for it, but basically it's an organization, GT Independence, I think is the name of the financial management system, who's handling self-directed transportation. And basically, the financial management service entity kind of handles many administrative aspects of the self-directed transportation service. They handle the agreement, they handle the payment, and then the payment for the per trip and per mile. So basically, a financial management system kind of services provider handles the self-directed transportation's mode of payment and agreement. So independent self-directed transportation providers, people, family, friends, neighbors, coworkers who want to become providers of self-directed transportation must apply through that system I mentioned, not have 6 or more points on their driving record, have a valid Ohio driver's license, hold valid liability insurance, and then complete a background investigation check, just to provide a kind of a modicum of safety, right? Then current providers who are already doing that non-medical transportation and transportation I mentioned up top can also provide it. They'll need to be a part of the FMS system like the other providers. So you can certified providers will be processed quickly through the FMS. Those certified as providers of the commercial NMT will be able to bill their usual customary rate. And then non-commercial certified providers will only be able to bill the established per mile rate or a negotiated trip rate up to $12 as a trip cap. And then there are 3 ways self-directed transportations services can be paid and reimbursed at the usual customary rate, per mile, and per trip. And I kind of followed that thread throughout the whole slide deck here. So usual customary rate is Uber or Lyft, other rideshare services, taxi, public transportation. Rate is the provider's usual rate that they charge for standard fare. Then per mile is certified DD providers use, other providers under agreement with the financial management system. And then rates are set by rule. And then per trip is the certified DD provider, other providers under the agreement, and then negotiate rate trip up to cap, which I mentioned up top. So here's a couple of uses and examples of the new service, the self-directed transportation. And here's what Jesse Russell in Delaware County, who receives it, said. Yes, I only use Uber. I use Uber 5 or 6 times a week. It's about 56 to 63 miles a week. Right now I use PDGS and the self waiver to pay for transportation. I will change to the new service, self-directed transportation, when it's effective. I use the Uber app. My annual budget is about $12,000 a year. Uber takes me to work, home, to get my medicine, get my nails finished. I've been doing this for close to 4 years. My parents used to drive me. This is better because it gives me freedom. The last time I had a doctor's appointment, the data bus, the Delaware Mass Transit bus left me. I had to use Uber. Then Christine Brown uses self-directed transportation. Right now I use PDGS and the self waiver to pay for transportation. I'll change to the new service when it's effective. My annual budget is $13,000 each year. In my service plan, I have $10,000 for yellow cab and $3,000 to buy Uber gift cards. The $3,000 is divided into $1,500 for the first part of the year and another $1,500 for the rest. I use it to take me to doctor, go to meetings like DD Council, and to visit my friends. She works at the OSU Nisonger Center and usually takes the yellow cab. I started this in 2012 before I had to mostly rely on my staff, my parents, or the mass transit in Columbus. CODA had to be scheduled at least 24 hours ahead and came really early. I would get to work before the place opened and had to wait outside. It was terrible in winter. With this service, I feel more independent and can get where I want when I want. So I'm going to take you to the web page that's devoted to self-directed transportation. Now, this is in this slide deck. It kind of would take you there too. I can answer questions, but also you can also send questions to waiver policy TA at dodd.ohio.gov through our Medicaid administration folks. But I'm going to take you to the website. Can you guys see that? Okay. Do you see the website now?
Yeah,
okay.
We see it. Mm-hmm.
Okay, cool. Sometimes when I flip over, it doesn't follow me. So basically, this is the place for everything you'd ever want to know about self-directed transportation. That PowerPoint I showed you is right here. The actual rule itself, for those who like to read the rule, is here. And there's also one pagers and self-directed transportation for individuals and families. I'll bring that up real quick. This again kind of is a lot less information than I gave you on the PowerPoint, but it walks you through all the stuff I was just talking about. Also takes you through the modes of transportations I walked us through, and kind of gives you a guide on FAQs and examples, etc. So you're welcome to take a peek at that when you want. I'm going to go back to the actual page there, and this will kind of walk you through anything you ever want to know concerning billing and payment, providing the service, what providers need to do to provide it, etc. And I'm going to put all of that. I'm going to stop sharing. I'm going to put the link for that page here in the chat so you guys can access that anytime you want to. And that's my spiel. I focused on self-directed transportation, but if you have any other questions, concerns around transportation and the DD system, I'm here to answer them right now.
Does anybody have any questions for Keith? It says there is a question there. Did you say that siblings could transport?
Yeah, yes. Yeah, that's one of the best aspects of self-directed transportation is you can kind of go in partnership with providers that are beyond a provider pool now. And so that would work. Yes.
Since we're talking to multiple counties, one thing I've run into here is the different county boards can implement this different ways, correct, Keith?
Well,
like how they give the resources to their client.
Yeah. The waiver system is based on need, right? So as you move into develop, this is a conversation around waiver access. So each county board does a similar needs assessment to see what would indicate if you are going to access the waiver or not. So this is once you have the waiver, the self-directed transportation is a new service in the service packages.
Looks like there was a question about the PowerPoint. There's two places you can look at that PowerPoint. We uploaded it to our SALT Google Drive because Keith provided the PowerPoint, but then he also provided a link just a little bit above the questions there, DODD.ohio.gov, and he has the link there and it was on the right side of the screen, partway down. There was different links to different documents, and you can click it right off the website.
There you go. Thank you, Patty. And there's also one-sheeters on that side too that kind of are simpler than the PowerPoint too. If it's a little too much information, because that's a lot of information I laid on you guys. Sorry.
And basically, I guess they could reach out to you if they have any further questions. Go to the website. Or they could go back to their SSA or their transition coordinator as a starting point to get things organized for this.
Right. And one thing that beyond waiver and beyond that self-directed transportation, which I think is a fantastic thing to have, that we have to be able to offer folks. But I think something Shannon said up top before some of you guys got on is we want to make sure that as we move into kind of helping people into entering the adult world, that transportation is one of the first kind of things we focus on. And that starts with like an inventory of what's all accessible to you, whether it's through DD or through any other system. And I would recommend, and you guys have probably already gone through Charting the Life course and what it is, but there's a one-page, and I'll put it in the chat here, a one-page tool called the Integrated Support Star. And I use it with people around transportation all the time, because what it helps you do is it helps you kind of build a baseline of all the things that are available to you, whether it's through DD or through eligibility based, through what you can do. Maybe you can even drive, or maybe you can ride a bicycle, or maybe there's mass transit possibilities that you haven't thought of. Maybe it's a neighbor, all the stuff that around transportation that you have available to you, so that you can have a full picture of what transportation possibilities there are, and not be dependent on one system or one way to do it, because it's a multiple strategies kind of thing. Transportation is truly that. And when Shannon was talking about how she chose where she was going to move based on mobility kind of ideas, I think that's really the way we look at it as a system is, let's think about transportation before we make any moves, because otherwise you're going to shoot yourself in the foot. So that's my 2 cents. And I'll put that integrated support star kind of thing in the chat too. And I'll shut up now unless anybody else has any questions.
I think this will come in handy with a couple of things. When I'm assuming, like when you cross county lines, we always stumbled with that. When you live in one county and you got a job either in the neighboring county, there's issues with transportation. This seems like it's going to help that.
Yes.
And the shift worker, the person who gets off at late, midnight or something, there were some stumbling blocks with who's going to pick them up and when, and things got delayed and they'd be waiting outside, like that one story you had outside the building at midnight waiting for
Right.
their cab.
Definitely. That's everything you're saying, Patty, is why they created this self-directed transportation, is to kind of meet those needs that the other way to do it couldn't. So definitely yes on all the examples you gave.
Anybody else have any more questions for Keith before we move on with Shannon?
Please reach out to me if you have questions, but you can't think of them right now, or if you just want to talk to me about all the stuff I just said and anything else that you have of interest. I'm here for you, and my email's there, and I'm going to put that support star link there in the chat, and then I'll be quiet for a while.
Thank you, Keith. That's everything was very helpful. Thank you.
Thank you, guys.
Shannon, I'm going to let you go ahead and take over.
Hi, everybody. So big thing I'll just add on to Keith. Thank you so much for coming. But as you saw, it still takes planning. You still have to know where you're going and what you're doing in advance. And so part of this first presentation I'm going to do, I have a couple different hats today. So while I am Shannon Webster, Greene County's Mobility Manager, I'm first going to be Shannon Webster, Greene County Mobility Manager and part of the Greater Regional Mobility Council. So we're going to go that route first. Our Serena, who normally would be providing this presentation for you, is a new mom and on maternity leave. So it's my pleasure to provide this presentation to you. Hopefully everybody can hear me.
Yes, we're fine.
Perfect. So this is the video. I'm going to ready to switch it over to YouTube that talks about our Human Services Transportation Council. While it is a little dated in the sense of it's from 2018, it does give you an idea about what we're doing with the Human Services Transportation Coordination Council and why it is so important. So can everybody still see my screen on YouTube?
No, it just dropped.
It figures. Hold on. How about now? Can you see the YouTube?
Yeah, now we can see the YouTube.
All right, let's pray it works and you guys can hear it too. So we're about to go. All right, so here we go.
Hello, I'm Brian Martin, Executive Director of the Miami Valley Regional Planning Commission. MVRPC, in partnership with the local transit agencies, developed a coordinated plan to improve transportation for people with disabilities, seniors, and people of low income for the region. To encourage collaboration, MVRPC hosts the Human Services Transportation Coordination Council meetings each quarter. We would like to thank Goodwill Easter Seals for providing space for the meetings at their headquarters. The Council's purpose is to increase options for people with disabilities and seniors through the coordination of public and private providers and the expansion of efforts and resources. Attendees include transit providers, users, and human service agencies who exchange information and work to resolve issues. Attendees can also participate in subcommittees to provide input in the selection process of who receives funding through MVRPC. The HSTC Council meetings are also a requirement for those wishing to receive Federal Transit Administration funding. This funding allows for organizations like RT Industries, located here in Troy, Ohio, to purchase ADA-compliant vehicles for only 20% of its value. The vehicles are used to transport non-drivers, allowing them to stay engaged in the community by taking them to jobs, medical appointments, shopping, and recreation. MVRPC will be working on updating the Coordinated Transportation Plan by the summer of 2019. We will be accepting comments about the updates early next year. For more information about the Council or to provide your input, please visit mvrpc.org. MVRPC is proud to facilitate this hard-working council as we continue shaping our region's future together.
Okay, hopefully everybody can still hear me.
Yes, we can hear you.
You never know with these things. Okay. I get back to the other screen. So why I said that was, why I said that was outdated is that you notice that it only talked about 3 counties here in Greene and Miami County. And that was our original Human Services Transportation Coordination Council to provide these services. What they have done now is made Ohio into a region of different resources. And we are now in this greater region over here as part of 8 different counties. Now, mind you, Logan actually defected and went over here to Region 6, but this regional structure is to review transportation services in order to reduce duplication and to fill in gaps of services. As you've mentioned before, this can help address different regional transportation challenges like getting across county lines or even inter-county transportation needs and priorities. This also can help with policy alignments with differences in driver standards and vehicle standards and eligibility and usage policies and funding alignments, because DODD had one set, JFS has another set, you have veterans having another set. So how can we bring all of this to increase and enhance our mobility options to those that we serve, as well as to increase and enhance the mobility management in this region? So we want to work beyond boundaries, the typical service boundaries, and be able to handle regions and provide or leverage, if you will, the funding among the providers to help improve the mobility across the entire region. Now, the coordination plan is what was mentioned in the video, is really to enhance the coordination and to improve the cross-county services, increasing awareness of existing services, and hopefully to expand and share services. The Greater Region Mobility Initiative, or GRMI, you will hear me talk about, is an effort led by the Miami Valley Regional Planning Commission, or MVRPC, and it is in cooperation with the Ohio Department of Transportation, or ODOT's Office of Transit. The purpose of the GRMI is to improve this coordination among transit providers and to enhance options for non-drivers. Much of the public transportation available in Ohio is based on single county transit systems, often operating within defined geographic boundaries, but it's in a fragmented manner. It can result in duplications of service, while there are still unmet needs that exist within and between their service areas. The ODOT researched the value of developing a regional structure for transportation services as a way to reduce the duplication and fill in gaps in services. So additionally, this regionalization is a way to facilitate more effective service delivery, as well as a wide stewardship of the money or the financial resources that have been provided to developers for projects to address identified challenges and unmet needs. They also help determine the best approach to implementing the goals and strategies that are outlined in that coordinated plan that you heard Brian talk about. You will see that for funding, Federal Transit Administration says that the 5310 specialized transportation services are to improve mobility for seniors and individuals with disabilities throughout the country by removing barriers to transportation services and expanding the transportation mobility options available. So they can help fund vehicles, preventative maintenance, provide mobility manager services, which I'm funded through a 5310 program through MVRPC. They can help with some pedestrian infrastructure, active transportation, but primarily they are for nonprofits to help transport human service agency clients. So as was mentioned, there is a quarterly meeting for this council. As you can see, there is a wide variety of individuals that are here. We also extend this invitation out to parents, caregivers, and obviously stakeholders or providers. We want to hear from those that utilize these services and what works and doesn't work. And if you're interested in being an advocate and coming to these meetings, I'd be more than happy to put you in touch with Serena, because the topics that are discussed here will affect you as well as your children or the clients that you serve. You can be an advocate. You can help support funding opportunities. You can give us best practices and we can give those to you as well. There's a huge resource and information sharing, and they've even started a forum online where you can sign up and start to learn from there the different options that are available, or post a question and it be able to go out to the community of stakeholders that are part of the council. So that in brief is the GRMI Council. Shoot, I'm not pushing the right buttons. That is what Serena Anderson's presentation would be. She is our representative from the Greater Regional Mobility Initiative from MVRPC, and I will be following up with Serena's contact information to Pat so that she can send that all out to you from there. So that's part one. Any questions on regional transportation and how that works, or the coordinated plan?
Will you be able to add her email into the chat box in the meantime? If anybody would have any questions, or the website link.
Working on it.
Okay.
Stunned everybody. No questions. I see how it is. No worries. Pretty sure, I'm just going to double check her info is on here, but I don't think it is.
There is a question out there. It says, what kind of initiatives are being worked on for cross counties?
As far as there are already agreements set in place for those that are on jurisdictional boundaries, that they will have one provider come to that meeting place and then the other provider, so that people can transfer between the two systems. I happen to work for an agency that we actually go into our neighboring counties. So you can also foster that to see if maybe your mobility manager or someone in an advocacy role can hopefully see if they can get providers that are willing to cross counties for that purpose. It really just depends on where in the region. We're in a unique place. We have urbanized areas with like Warren County, and obviously as you go more south into Cincinnati, but with Dayton and Montgomery County. And then all the other counties around are more rural. So we have a unique mix in our greater region of how does rural, suburban, and urban eyes providers be able to provide transportation across the region. They are currently finishing up a study that should be published here momentarily on hopefully being able to have some sort of cross-county scheduling system where all of this providers can talk to each other behind the scenes, so that if you call me for a trip, I can put it up, like, let's say on a chat board, if you will, and other providers can see if maybe they can provide that trip too. Very crude analogy, but it's just a way of, you won't have to call 20 people to find a ride. You can have one person to call, and then they help you find that transportation among the entire region. That's the goal. It's not going to happen next month, but it is the goal of what the regional progress is for right now and how we can help make it easier for the steps of the rider. Not exactly sure when the study is going to be published, but the link that I just gave you is where the information would be once it is. Any other questions?
Looks like we're good for now.
Perfect. All right, now I'm going to wear my other hat. So let me figure out where my other presentation is. They have all these tabs and you can't see buttons. Can everybody see that on the screen?
Yes.
So this is my other hat. It's the day job that pays the bills. I work as a Greene County mobility manager, helping Greene County residents find transportation solutions to their challenges. I am housed at Green Cats Public Transit. However, the mobility options that I offer to those is all that are available, whether that is with Green Cats or not. I also am the only travel trainer in my area. And as I mentioned, I'm a mobility manager and I partake in that 5310 mobility management program. So for Green Cats, anybody can ride Green Cats for any trip purpose. You can see a variety of ages. It's ages 14 and older to ride without a parent or an adult, as far as technically how the rules go. Now, when I do my travel training, I always tell people, while you can do that, I still suggest you let people know where you're going. It doesn't hurt for someone for safety reasons to know that you're scheduling a trip. So always suggest that you tell someone where you're going. Now on my presentation, I had video links for you. Currently, I'm under redoing these videos as we had changed our services on July the 1st. However, it does give you an overview of how someone in like a minute and a half, how someone can schedule a ride, as well as I have a travel training page that I'll show you off our website when I'm done. Now with scheduled rides, there's two types of services. Green Cats is different in the sense, if you're familiar with like a CODA in Columbus or Dayton RTA, those have bus stops and they provide a paratransit service for those that are eligible. We're different. We do not operate a fixed route service. So our scheduled rides is part of the demand responsive in the sense that people can call up and schedule a ride and they don't have an eligibility process to go through. As I mentioned, those hours changed on July the 1st. So our hours of operation weekdays only are 6 a.m. to 10 p.m. It does require an individual to schedule in advance, a minimum of 2 business days by noon, up to 30 days in advance for their trip. It is subject to availability and it's a first come, first serve. I always suggest people to schedule as far in advance as possible and take advantage of that 30 days in advance. As I mentioned, our service area is mainly for Greene County and its residents, and all of our trips have to originate in Greene County. However, we will go into neighboring counties, and if we took you there, we'll bring you back. So those initial trips and return trips all have to be scheduled in the same phone call. Door-to-door trips are available upon request. Typically, our trips when they are scheduled is a curb to curb. So we require the individual to be looking and watching for the vehicle to arrive. And then as it comes, they come out and meet the vehicle at the curb. If for whatever reason that you need door-to-door assistance, the driver will come to your door and help you to the door of the vehicle, whether using the lift or what have you. However, they won't go through the door, meaning they won't come in your home, help you into a mobility device, and then wheel you out of the door to get you to the vehicle. So that's important in case you need a personal care attendant or a caregiver on hand to help you with those in order to be able to use the service. When scheduling a reservation, I often liken it to scheduling to have pizza come to your house. They need to know who you are, they need to know what address they're coming to, and they need a phone number because that's their contact. But for us, date of birth is important because like I mentioned as I opened the first slide, you have to be 14 years of age in order to go on your own without an adult. For mobility, knowing the size, make, and model of a wheelchair, or if you have any other type of device like a cane, a crutch, or a walker, even walking slow, is important to tell the scheduler as they make those notes into your profile and also add extra time to your pickup and drop off so that you'll not be rushed in using that mobility to get on or off. As I mentioned, if you need a personal care attendant, make sure to let the scheduler know that you have one, because if they're riding with you, while there is no cost for them to ride, we still need to know how many people are going to be in the vehicle so that we have a seat available for them if they ride. And this also holds true to a service animal. If you have to use them to help you with your mobility, you need to let the scheduler know that. And regarding for the trip information, we got to know the date, or if you're scheduling for multiple dates, up to 30 days in advance of your trip requests. We have to have the addresses, the exact complete addresses of both your pickup and drop-off locations. Green Cats is also unique in the sense that it is destination-based drop-off. So we need to know the time you need to be at your destination, not the time you want to be picked up initially. And then if you do need a return trip, we need to know that return trip time home. Oftentimes, I tell people if they're scheduling a medical trip, they need to pad that a little bit because while one time your doctor may take 20 minutes and maybe 2 hours for the next trip. So make sure that you schedule that appropriately so that you don't miss your pickup or return trips. Again, on the flex route, again, on the PowerPoint presentation, I provided links to our travel training page on planning a flex route trip, as well as the video. Again, these videos are going to be updated hopefully soon with our new service changes that became effective on July 1st. If you need to see a list of those, you can go to that link and it'll tell you what all was affected. Flex routes are unique in the sense that they do have defined routes and time points. So they are a second service delivery for Green Cats. They too only operate during the weekdays, and mainly they operate between 7 a.m. and 5 p.m. with the red line being a little different just because it operates in the morning from 6 to 10 and then in the afternoon from 2 to 6. It does offer a transfer to Greater Dayton RTA and a way for people to get out of the county into Montgomery County. You can also schedule deviations, much like the scheduled rides. They have to be 2 business days in advance by noon, up to 30 days in advance of your trip date, and they have to be within a half mile of the routes. So here is a map. I don't know how good you guys can see, but it can show you that in Xenia, we've got the green line that mainly circulates the social service agencies and the downtown area for those that are needing to get around. That is a 75-minute loop, as well as the yellow line connects Xenia Town Square here through Yellow Springs into Fairborn at Park Hills Plaza. That yellow line does go through Yellow Springs, much like the seat of Xenia is the county seat of Greene County is Xenia. You're seeing the colors here, hopefully. Your blue line, the high school colors for the Skyhawks are blue. So your blue line is circulating and taking you around Fairborn with another 75-minute loop. And then the Beavers in Beaver Creek are orange and black. So this flex line does take you mainly from the Park Hills Plaza, but this one new for July 1st will go all the way to Xenia Town Square. So individuals here now have the opportunity to not only get to Dayton through the red line, they can get to Beaver Creek through the orange line, circulate Xenia through the green line, get to Yellow Springs and Fairborn through the yellow line, or they can also use the red line to go to Central State and Wilberforce University and get to the east end of Xenia. So this is the flex routes. They do not require reservations. If you're anywhere along the line, you can flag them down and be able to get on. And those routes and schedules are available on our website. However, deviations do require a advanced planning and scheduling. We also have an online map that's available that I'll show you it once I get done with this presentation that you can actually use in planning. This magnifying glass right here, you're allowed to click it. You can type in an address and it can take you anywhere on this map where that address is located. It also gives you a visual reference if that address is along the line. So it's great in planning. You can also use me, but this is a good aid that the GIS department gave us from Greene County to help individuals do some online trip planning because our routes are not on Google Maps. And much of the urban transits like Greater Dayton RTA or Cincinnati are. So you can use Google Maps for transit planning for them, but unfortunately not for us yet. Now I've talked about the 2 different types of services, but I haven't told you the cost. So for Green Cats, the current fares is effective of July 1st. To go anywhere within Greene County, it is going to cost you $4 each way. If you're going to or from neighboring counties, that is an $8 each way trip. And you pay for these trips per one way. So each time you board the vehicle, you pay a fare. For flex routes, if you need to go to a destination that is along the line, it is only a $2 fare. So that is an option if you need to use this regularly to get back and forth to work. That may be a better option than using a scheduled ride, but it really depends on where you live in the county and if that service is available to you. Do notice that no service is available on weekends or on these major holidays. So if your children or clients have to work in retail or food service, many times these holidays are days that they have to work. So make sure you have a plan in place if they are using public transportation. Again, self-directed transportation is really crucial when many times the public options are not available. Green Cats allows you to sign up for the major service disruptions on their website, and you can get an alert directly sent to your cell phone or email if something comes up as a service disruption. You want to mention that there is no extra charge for flex route transfers on one-way trips. So if you go to Park Hills Plaza or Xenia Town Square and need to get to another flex route to continue to your destination, they will not charge you the fare again. All fares have to be exact change. The bus driver cannot provide you any. And unfortunately, I just heard today somebody paid $20 for their $8 trip because they had no change. So these things are things we don't want to happen. So definitely having to plan ahead. Tokens and Flex Route monthly passes can be purchased at our office. It is along the Greene Flex Route, and it is open Monday through Friday, 8 a.m. to 4 p.m. The office does accept cash, check, or money order as the current methods of payment. For additional information, I wanted to make sure that individuals realize that if they're on the Flex Route, and they can call the dispatch ahead of time if they're at a time point and they're unable to actually physically flag the bus. Or I also suggest to let drivers know when they board the bus where they need to exit. That way, the drivers are really cognizant of what people and passengers have told to them. They will make sure that if you're having a squirrel moment, they'll make sure that, hey, didn't you tell me you needed to get off here? They're pretty good at remembering that. If you look at the schedules online, you will see that there are certain time points that say upon request only. That means that they're not going to that time point every loop. However, if you come on board and tell the driver you need to go to that time point that's on request, they will make sure to do that for you. Versus if you also need to be picked up at that time point upon request, make sure to contact dispatch prior to you wanting to get on board, and they will let the driver know to be looking for you. You also can receive a reduced rate if you are a senior or have a permanent disability. We instituted a new half fare card, and to obtain that half fare card, there is an application and documentation that needs to be filled out that I can help individuals with. And as I mentioned before, personal care attendants ride for free. Additional services is they do have same day service. So if you've called ahead and tried to schedule something and let's say it didn't work out, you can try and call the same day to see if maybe anybody canceled and they can fit you in. I didn't change the slide here, but the cost will be the same as $4 in one-way county and $8 for out-of-way county. As you can see, that was the old rates, so I apologize for any confusion. It is $4 and $8 for the same day service, just like regular service. Green Cats is a provider of the non-medical transportation that Keith was mentioning in his presentation. If we get the ISP from the SSA, then these services are at no cost to the rider. However, you have to go through your SSA to get that determined eligibility, and then they in turn tell us who is eligible for those services. So while Green Cats has a public component, we also have a private provider, if you will, component of the non-medical transportation. We also work with Jobs and Family Services to provide non-emergency medical transportation, which is still at no cost to the rider. The scheduling office would just need the rider's Social Security office to verify their eligibility, and then trips to their non-emergency medical appointments would be at no cost to them, including going to the pharmacy. Lastly, all this information that I told you about can be tailored to a person and given to them in a way that is more palatable based on travel training. I assist individuals in developing their skills that they need to be able to feel safe and independent in traveling within their community. It is involved an intake process, as well as giving them knowledge of the different transportation options that are available to them, including a resource folder. And if they are interested to go further, I can even take them out on the vehicles or arrange a tour for different options. So this is all that is available to people here in Greene County. but then also other counties, depending on which county you're in, I may be able to connect you to a travel trainer in that area. I also manage a website called Miami Valley Ride Finder. Currently for our area, it lists public and nonprofit transportation options in Miami County, Montgomery County, and Greene. I am looking to expand it across all 8 counties in our Greater Regional Mobility Initiative area. However, it doesn't schedule any rides and it doesn't own any vehicles. It's strictly an information resource. So you can go on the main page, you can look, kind of whittle down and filter what kind of trip you're trying to need by the location or the ride type or the purpose. And then the results will give you who you can then follow up with to try to see if you can get transportation options to you for that, whatever trip you're trying to take. Lastly, the mobility management, I wanted to give you a brief description of what my job does. As a mobility manager, it's an approach to designing and delivering the different transportation services, and it's all customer based. So we look at a community vision, and that's where that coordinated plan comes in, and how the entire transportation network of public transit, private operators, active transportation people, and cycling and walking, even volunteer driver programs, which now can be your family and friends who are doing self-directed transportation. How can all those people work together and deliver the community their needs and when it comes to transportation? That's the key to mobility management. That's the key to our coordinated plan process. And if you're interested in learning more about that and being able to be involved and make change, please let me know and I'll be more than happy to put you in connection with those individuals. Because as mobility managers, as Keith mentioned in his, we try to give you all your options prior to you needing to go out to your community, because those activities of daily living, just getting in and around your community or being able to go to the grocery store or get to a job, if you don't know what your options are, how can you successfully go interview for a position and tell them, yes, I can get to and from work? So I'm a big component of see your local mobility manager, get some travel training, figure out where you can go, and then that gives you a radius as far as where your jobs or where in the community you can be. We also can help increase local capacity. So if we don't hear from our stakeholders, we don't know what the needs are. We only know what people bring to us. We do surveys. We highly suggest to, answer those. Whatever you're willing to do, we're willing to listen and try to help. So we really want to assist individuals in accessing all their community transportation options. Myself, I'm in Greene County. We also have a mobility manager that would be in Butler County. We have someone who works with alternative transportation options in Montgomery County. And then in the other region area there of Champaign, Dark, Clark, and I'm missing one, Shelby, we also have a mobility manager that handles those rural areas. So from that regional map that I gave you, the counties are covered, and then we also share resources among each other. So however we can best serve you, I am here to help. I'm also connected on the state level. So if you have needing help across all 88 counties, we have about 65 mobility managers, or sorry, about 40 mobility managers covering about 65 of the 88. So Ohio is here to help and bring transportation options. We just need to know how we can better help you, or if there is questions, we are here for that type of a service. And with that, I will finally shut up. So I've done 2 presentations now. So let me know if you guys have any other further questions.
Was there a link you were going to show us? It was partway through. There was a link you mentioned.
Oh, I said I was going to go on the website, didn't I?
Okay, yeah.
Thank you. I'm glad someone's paying attention. Let's see. So. Can everybody see that?
Yeah.
So that is the online GIS thing for Green Cat. So like I mentioned, we can type in an address. This happens to be my office. And then it'll zoom in right to where that is located on the map. And you can see that it's right near the transit time point number 7 at Green Cats Public Transit. As a mobility manager and travel trainer, I also can help provide trip planning and different services. If you're confused, you just need some assistance on how to get to your final destination, but may not need a full travel training. And then as far as the website goes, can you guys still follow me? Is it still showing?
Yes.
Perfect. So you can do Green Cats. It's the easiest way to find us. Or you can do the lovely greencountyohio.gov and go under departments here and then find Green Cats Public Transit. Thanks to COVID, I really beefed up our website. So this has all the overview of services. These have the breakouts on how to contact us and fares, along with fare assistance programs that are available. The Flex Route page shows you all of the maps and schedules based on the link and some connections there. You also have the scheduling a trip page, which I gave you the brief overview, but if you forgot anything, it has it all here. You also have an option of making an online trip request by clicking here. So if you do not want to talk to someone, you can also do that online, or maybe you need to make the trip request after hours. They will then take care of that the next business day. Other resources here. So I mentioned signing up for the notification alerts. We also have various helpful guides, like on how to use bike racks or getting to the airport or the Greyhound bus, or if you're interested in emergency preparedness or community resources from our public health department. We also have a bi-monthly, which is every other month, e-newsletter, and there's electronic issues published there. I can tell you the latest article just told people about our car fit program that we held on Monday. Our commute resources, I have various under active transportation, as well as mobility solutions, whether it's with a senior center. Pink Ribbon Girls helps those that are undergoing cancer treatments with free transportation, or if it's just help with riding Lyft or learning about your commuter benefits. So these pages are outlined to be able to help individuals hopefully navigate and find information. And then if they have more questions, they'll be able to ask me specifically. The mobility management, I gave you that definition. This is where it came from with National Center for Mobility Management. We have our Human Services Transportation Plan, as mentioned in the video that you watched. Our Greater Regional Transportation Coordinated Plan was actually updated, so it's good from 2020 to 2024. As well as we have the Active Transportation Network, which helps provide safe and equitable walking, biking, and transit connections. I have information and referral assistance, so you can find more assistance here and different links that you can go to if you need more information. Trying to provide as much as I can so that you can let your fingers do the walking, and then you got me if you have any details. Travel training is more in depth. If you personally are in Greene County and you need to provide a referral for a client or a student, you can fill one of these out. And I also provide travel training in group, as well as I have the rules and guidelines, and then helpful hints in either planning a scheduled ride or planning a flex route trip. And this include how to read the schedule. So all of these are tried to be more helpful in helping individuals be able to find their resources and give them definitions of common terms or different things that they can hear from. And that can include street smarts, COVID topics and signs, pedestrian safety, or even how to plan a safe pedestrian trip. Now I'm going to be quiet because it's 7 o'clock.
Thank you. Thank you for all that, Shannon. Now, if someone's from, let's say, Montgomery County and they want to contact their mobility manager, do they then talk to you, or or Butler County or another county? Do they reach out to you first, or is there on that website, was there a list for mobility managers, or?
On the ODOT site, there is a list of mobility management system, but I can provide a link to them. That list may or may not be updated right now. Not all counties have mobility managers, so it may be another person filling the position that does mobility management like things, but may not have that title as well. So I feel free in our region, I can connect you to who you may be able to talk to. Across the state, I can do the same.
Yeah, I saw there's some people from Warren County too in here. So, so I guess if you want to know more about the mobility manager of your area, you can reach out to Shannon, which I know your last slide had your email. Can you put that in the, I'm looking to see, can you put that in the chat box as well? So they have that. Oh, there you go. Never mind. I see it. Does anybody have any more questions for Shannon before I'm going to close the recording here in a minute? But I wanted to, before I close the recording, just a reminder. So this month, we're looking at independent living. Last night was housing. Tonight was transportation. Next week, we're working with the students, the SALT teens and me, and we're talking about Money 101, budgeting on Tuesday night at 6 o'clock. And then at Lunch and Learn, we're going to go into Angel Sense, which is a remote technology. We're going to be hearing from one of the representatives of the Angel Sense, but is also a parent, and why she ended up becoming a representative for Angel Sense, just because she had a child that did a lot of running. But they're going to be speaking next week for us during our Lunch and Learn. And then we're going to end our month with a presentation on life skills. It'll be the last Tuesday of the month. But you can all find all that on our Google Salt Drive. So 1 second while I close, I want to thank you, Shannon, for your presentation and all the information you provided. And same with Keith had to leave us, but same for Keith. They did a wonderful job, bringing information on transportation. I'm going to open it up to, I'm going to close the recording and we're going to open it up for some discussion. If anybody has something on their mind that instead of typing it, if they wanted to ask. So 1 second while I close that.